Families often ask, why did you recommend this treatment facility or this treatment plan? Family First Intervention has been doing drug and alcohol and mental health interventions since 2005. And when we first started doing this, treatment was much different than it is today. Treatment was much different in 2005 than it was all the way back to 1960, before the disease model was incorporated or brought into the treatment of substance use disorder by Dr. Jelinek, where everybody had a disease and this was now a medical problem. So what we look for in a treatment center is what works. Because I'm here to tell you something. I have done an internship at a state-funded facility where all of our patients were Illinois Department of Corrections, Cook or Will County Jail, or DCFS. And I have done 3-day in-services as part of training at some of the most world-renowned treatment centers in the nation. And I'm going to astonish you and tell you that all of them are doing the exact same thing. The only difference between where I went to my internship and where I did a 3-day in-service with a household brand name treatment center was the amenities and the food. The counselors were the same level of credentials, the curriculums were the same, everything was the same. Why? Because treatment centers don't run their centers. Insurance companies do. And all of them have to offer what is called evidence-based treatment. They're all doing their one-on-one, they're all doing their groups, they're all doing their activities, they're all taking them to outside meetings, they're doing the exact same thing. So why this center that we picked? Because the difference between most of the centers out there that are not like they were in the 60s and certainly not like they were in 2005 have taken on a new concept of meeting people where they're at, rolling with the resistance, and truly believing that the person in treatment is a victim and that the family has to accept that relapse is part of recovery and that they have to let that person, do what they think's best for themselves, which we know is not effective. The hardest part of our job in our family recovery coaching, outside of helping families reduce their reactivity, is challenging therapists at treatment centers. I mean, I have messages and I have had multiple conversations from treatment centers and asking me, and excuse my language, what the hell are wrong with therapists today? And the treatment centers we work with, they are very respectful, but they hold your loved one accountable. They listen to the family's wants and needs. So when a therapist says, your loved one's ready to come home, the places we work with will ask the family if that's okay. Not the other way around, where a therapist assumes it's okay or tells the family they need to be okay with it. Because your loved one has been running the show far too long. And if their therapist thinks they're good to come home, then their therapist can let them live with them. Because what we do different at Family First Intervention is we consider the family's heartache and turmoil. We consider what the family has gone through. When you come into our aftercare department, the reason we're referring you to this treatment center is because we have weekly meetings with these facilities. We meet with the clinical staff. We get updates on your loved one so that when we hear what's going on in treatment, you tell us what's going on from your vantage point, and then we can draw out the discrepancies. In other words, the treatment center says your loved one's doing great. Family gets on the phone and says they call us every day and tell us how much this place is horrible. Now we have a discrepancy, and we could bring that back to the treatment team and use that as a therapeutic tool or instrument to help draw that out. Most treatment centers don't care about you guys. Yeah, they have family programs and they run you through the basics of enabling and family systems 101, but they're not working with interventionists and therapists who are working with families to draw out discrepancies and bring this whole family system of dysfunction together. So why this center? Because the places we refer to, the therapists get it, the treatment center owners care, they collaborate with our family recovery coaching, and we challenge your loved one when there's a discrepancy. So if you want to forego our suggestion and go with a brand name treatment center because some business development representative sold you on it, or your doctor gave you a brochure that somebody left there, or that you know somebody who knows somebody that went to another center, you can do that. But just remember, when they discharge your loved one in 30 days, or they try to leave, or they're not meeting with our staff, You saw this video and you understand why it is so important to work with a center that collaborates with, we're your advocate. We're here to help you. We're to help build a better, bigger treatment plan so that your loved one doesn't relapse and you go back to where you were before you even made the first call to us. That's why we refer to where we refer to, because those treatment centers still get it and they hold people accountable.